Hello, this is AI in Medicine, a presentation by Andrew Trace. So first let's look at the types of that are involved in medicine. We have machine learning, which makes up supervised learning, unsupervised learning, and reinforcement learning. Supervised learning is when you build a mathematical model of data with desired inputs and outputs. Unsupervised learning takes a data set containing only inputs and finds the structure in the data, such as a grouping or clustering of data points. And reinforcement learning focuses on learning when good or bad choices are not available in real time. There's also natural language processing, a, a, a tool that enables computers to read, understand, and derive meaning from human language and manipulate natural languages to perform desired tasks. There's neural networks, which is images or speech which process through several hidden layers of connected artificial neurons used on medical imaging such as skin lesions. And then there's deep learning, which is based on artificial NNS inspired by information processing and distributed communication nodes and biological systems that use multiple layers to progressively extract higher level features from raw input. Finally, there's computer vision, which includes the method and the technology which is used to automatically extract information from an image. Robotic assisted surgery, or RAS, has been used in cardiac surgery, thoracic surgery, gastrointestinal surgery, gynecology, orthopedic surgery, spinal surgery, transplant surgery, urology, and general surgery. Surgeons used to only operate based on what their eyes could see. Now cameras and tools could be inserted in a small incision and can do surgery with great precision. This allows for greater recovery time and reduced post-operation complications. The most famous use of RAS is the Da Vinci robot, developed by Intuitive Surgical Inc. There's also computer-assisted surgeries. While RAS focuses on physical surgical robots, CAS technology uses computer technology for surgical planning and enhanced surgical guidance for surgeons. Main CAS features entail the creation of virtual images from the patient, diagnostic images, analysis and processing, preoperative planning, surgical stimulation, and surgical navigation. In a review of 95 studies, benefit in clinical outcomes which were reduction of length of hospital stay, reduce in blood loss and transfusion rates, and reduction of complications. This is a great success in the field of medicine. Although the lower hospital stays result in a lower cost for hospitals, the equipment raises the cost. But as the technology is used more and more, it will eventually reduce the cost in the long run. So this will reduce cost in the long run. Then we have the virtual nursing assistant. We've seen the rise of virtual assistants such as chatbots and virtual assistants, but how can that be applied to medicine? We are now seeing chatbots in medicine called the virtual nurse assistant. The virtual nurse assistant can reduce hospital visits and the workload of healthcare professionals. Your.MD is a chatbot that works in the UK and has been shown medical accuracy of 85% of 20 common medical conditions. This is a great advancement in the field of medicine. Another VNA, senselessly, utilizes a patient's medical history and monitors a patient's condition. The platform was trialed 72 heart failure patients. It was able to reduce readmission rate by 75% and lower the cost by 66%. Then we have diagnosis and prediction. Diabetes the medical field is taking advantage of AI to diagnose diabetes. Diabetics are taking advantage of technology such as the Medtronic Guardian Connect It was the first AI-powered and FDA-approved continuous glucose monitoring. With this technology, someone can predict blood glucose 60 minutes in advance. This has definitely come to a relief to people who suffer from diabetes, as this technology has been able to help them and will continue to help them in the future. Some AI are being used for cancer prediction. For breast cancer, AI was able to be 99% accurate compared to manual review by doctors and saved a massive amount of time to diagnose. In 10% of 543 patients, the manual review took about 50 to 70 hours. AI is clearly being able to reduce the amount of time needed for these diagnostics and are being extremely accurate as well. Alex.net and GoogleNet, which are learning positive and negative x-rays for tuberculosis, were 96% accurate over 150 cases and has increased due to deep learning AI. Research at the University of Columbia Research Center and IBM Watson Research Center have developed an AI that is 100% effective for diagnosing psychosis in susceptible individuals using NLP and ML machine learning as opposed to traditional diagnosis, which is 79% accurate. We're seeing that these AI are not only being cost effective, they're being extremely efficient and accurate in their diagnosis. Medical image diagnosis. MID can be utilized in healthcare for multiple cases, such as the identifying cardiovascular abnormalities, detecting musculoskeletal injuries, identifying neurological diseases, identifying thoracic complications, and common cancer screenings. In a meta-analysis, AI and healthcare workers were compared. The accuracy of AI with the sensitivity with a mean of 79% and specificity with a mean of 88%. DL models have pooled specificity of 92.5% compared to healthcare professionals of 90.5%. The DL method proves superior. Image recognition in breast cancer has been a great tool to reduce the amount of false positive and negatives. And testing skin lesions, again, AI was 72% accurate compared to healthcare professionals, which were around 66%. AI have been looked at optical coherence tomography scans and have been 94% effective. This again states the great amount of accuracy that AI has been able to diagnose with medical images, and we can only expect greater things from the future of AI. In conclusion, AI has a fantastic capabilities to reduce healthcare costs, providing preventative healthcare, ease the work burden of healthcare professionals, and provide accurate diagnosis. With a lower number of people in healthcare, these advancements could help aid these lower numbers of healthcare workers. Developers still need to fulfill standards, regulations, and solve problems emerging from emerging legal constraints. Thank you, and that is my presentation on AI in healthcare. Here's my sources.